Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
Getting diagnosed with cancer is bad enough. But then, if you're like a lot of people, you need to have chemotherapy to help control it. And chemotherapy has some unpleasant side effects, no doubt about it, as you well remember, I'm sure, Tracy.
That's quite an understatement, Dr. Shives.
And yours was what, 20, how many years ago?
Almost 30 years ago.
Good for you. Well, one of the biggest concerns for people undergoing chemotherapy treatment is the thought of losing their hair. Was it a big deal for you?
It sure was. It was very traumatic.
And this, I think, is especially true for women. Because you and I both know guys who shave their heads because they think it looks cool and they're buff. And actually, for a lot of guys, it does look pretty good. But you've never seen a woman intentionally shave her head, have you?
Not lately, no.
Well, hair loss during cancer treatment can take an emotional toll on the patient. And some have described it as a signal to the whole world that you've got cancer. And I can see why.
It's true. It was one of the first questions that people would ask me. Did you lose your hair? Mayo Clinic is now using a new technology that helps prevent hair loss during chemo treatments as an option. It's called cold cap therapy, and it involves wearing a special cap set at very cold temperatures that protects a patient's hair follicles from the toxic chemotherapy, and hopefully your hair won't fall out. Joining us by phone from Mayo Clinic in Jacksonville, Florida, to discuss how cold caps work is medical oncologist Dr. Saranya Chumsri. Welcome to the program, Dr. Chumsri. It's nice to meet you.
Hi, thank you for having me today.
Yeah, thanks for calling in. So I bet you've got a lot of women patients who love you.
Yes, I believe so. Now that we have the cold cap treatment available for patients who are on chemotherapy, it is making my life much easier in order to tell them to go on and get the chemotherapy. It's very easy for me to talk to women to be able to accept more chemotherapy.
Are you going to lose your hair when you have chemotherapy, or there's some drugs that does not, or that are worse than others? Where are we at with that?
So most of the adjuvant chemotherapy for breast cancer actually cause almost 100% hair loss. Depend on the regimen. So most of our second and third generation regimen is more effective. For breast cancer treatment, it's actually cause almost 100% hair loss.
And why does it happen? Why do you lose your hair when you have chemo?
So chemotherapy kill rapid dividing cells, including cancer cells, but it also causes collateral damage to other normal cells, including the hair follicle cells that because hair growth, the hair follicle grow constantly, and that's also get affected by chemotherapy.
Are there other parts, so hair, it affects that? What other parts of the body does it affect?
Right. So most of the time, as chemotherapy kill rapid dividing cells, hair follicles get affected, and some other dividing cells, including cells in the marrow, like the blood cells, and also some of the epithelial lining in the GI tract also can get affected. But we actually have come a long way in dealing with some of these side effects of chemotherapy. We're doing really well with controlling the nausea. We have multiple medications that can help control blood count and help with the white blood cells like growth factor support. But until now, hair loss is one of the most dreadful side effects of chemotherapy that we haven't been able to control.
So tell us how or why the cold cap works.
So cold cap works by basically it applies the cold to the scalp. So when we give chemotherapy to patients, chemotherapy only floating around, circulating around in the patient's body only a couple of hours, and then after that it clears up from their system. So cold cap works by applying the cold, which causes vasoconstriction, and it helps limit how much blood flow to the hair follicle, and it helps preserve hair follicle that way.
Oh, so the blood vessels constrict, so the chemotherapy doesn't actually get to the hair follicles.
Right, that is correct.
And does this work all the time and for every agent that you use? I mean, is it highly successful?
Right. So if you look at the study that was published earlier in JAMA earlier this year, that was a two randomized controlled trial that randomized the patient a 2-to-1 to two part of the patients had the cold cap, and the other one part did not receive cold cap. So those patients that did not receive cold cap actually has 0% of patients that was able to retain their hair. with the anthracycline and taxane-based adjuvant chemotherapy that we commonly use in breast cancer. But among patients who receive cold cap, up to 70% of patients actually was able to retain their hair more than 50%. So not to the point that women would have to wear a wig or cover their head. So it's not 100%, but majority of patients was able to retain their hair.
That's impressive.
Yeah, pretty good. Do you ever have any patients where you put the cold cap on and they say, "Ooh, I can't stand that. Stop. I don't want to do that. I'd rather lose my hair."
Those are the Florida patients.
So most of my ladies that use the cold cap, they are actually very, very dedicated and they want to keep their hair. So the majority of them was able to keep their cap on. If you look at the study, the discontinuation rate is actually quite low, and most of the side effects or adverse events is usually just grade 1 or 2, usually mainly the headache and some of the skin irritation, but most of them it's actually very well tolerated, especially now that we use the cooling system, which constantly keep the temperature constant compared to in the old day where we used to use the there's also other rental cold cap that you can get from several places that you have to keep it in the dry ice. Right. So that's and then you have to keep constantly changing it every 15 minutes. So every 15 minutes when the cap gets thaw and it gets warmer, and then you constantly have to keep changing it. So my patients that use those old systems usually describe that they get these ice cream headache every 15 minutes, and they have to change the cap. But with our the new system that we have that constantly keep the temperature constant, it's actually very well tolerated by patients. A lot of patients love this system, and it has less hassle that they have to go and get the dry ice and provide some additional thing, and then they have to keep their hair colder. Take with about several hours prior to giving chemotherapy. So the system is actually take less time and less side effects.
I made that crack about Florida, but how cold is cold? What is the temperature of this ice cap?
Right. So the temperature is about 3 degrees Celsius, so 37 degrees Fahrenheit. So kind of comparable to being in the
Minnesota
refrigerator. not.
It is that cold in Minnesota at some point. Yes.
Like 37 a day. So how much does this cost, and does insurance cover it?
I think some of the insurance started to consider scalp cooling system, like Aetna started to consider covering these kind of systems. And I heard that some of the states, like Massachusetts and Connecticut, already had a public policy that insurance company has to provide partial coverage for this kind of scalp prostheses. But as of now, in Florida, we charge about $400 per session per treatment, and that's the base price that we have right now.
Yeah, so not cheap, but so hopefully more and more insurance companies will cover this, because the women, I can understand, really want to keep their hair, huh?
Right.
We've been learning about cold cap therapy from Dr. Saranya Chumsri, a medical oncologist at Mayo Clinic in Jacksonville, Florida. Thanks for joining us today, Dr. Chumsri.
Thank you for having me.
Yep. Thanks, Dr. Chumsri.